So we've known for a long time that several cancers have a strong inherited or genetic basis. Most commonly, people think about breast cancer, ovarian cancer, or colorectal cancer, where we know these cancers can often float in families so that multiple relatives, generation after generation, develop those cancers. Up to now, most of the testing for these cancers in terms of genetic or inherited causes were very expensive, and that led to production of guidelines which stipulated which patients should or shouldn't be tested for genetic causes of cancer. This often was targeted towards people with young or early age of onset of cancer diagnosis, a strong family history, or particular types of features. Our question was, now that genetic testing is becoming more mainstream, we can test for dozens, if not close to 100 cancer genes on just a single sample of blood or even saliva. What about if genetic testing was made broadly or universally available to all cancer patients? How often would we find a genetic predisposition to cancer? How often would that have been missed had we just followed the strict clinical practice guidelines I was referring to? And maybe most importantly, how often would it change the type of treatment that we select for our patients with cancer? So in this study, funded by the Mayo Clinic Center for Individualized Medicine, we enrolled over 3,000 cancer patients across all of our Mayo Clinic destination cancer centers in Phoenix, Arizona, Jacksonville, Florida, Rochester, Minnesota, as well as a community oncology program in Eau Claire, Wisconsin. All of these patients were offered at no cost to them genetic testing using a large gene panel of 84 cancer genes. If they were positive for one of these mutations, they were also offered genetic counseling for that cancer syndrome, and their relatives. Any blood relative was offered no cost testing for that same gene mutation for 90 days. What we found as part of this study is that nearly 1 in 8 cancer patients had a genetic predisposition, a genetic marker or a mutation in a gene that was inherited, likely from their mother or their father, that predisposed them to developing the cancer that they eventually presented to Mayo Clinic with. More interesting than even that finding was that nearly half of these patients, 48% to be exact, would have been missed. We would not have found that genetic mutation had we not tested all of these patients, regardless of the clinical guidelines. So that told us that the clinical practice guidelines are not very sensitive for identifying who does or doesn't have a genetic mutation that is leading or predisposing them to cancer. It turns out for those patients who had a high-risk genetic mutation, we could find evidence that nearly a third of these patients had a modification in the type of surgery they were offered, the type of chemo or immunotherapy they were placed on, or even enrolled in a clinical trial that they might otherwise not have been selected for. So this really does open up treatment and management options that might not have been accessible to patients. Finally, we wanted to look at the question, if you have a genetic condition, we know this floats in your family, how often do your family members undergo that confirmatory or cascade genetic testing? That really is the power of genetics. By identifying that genetic cause of disease or cancer in you, we can hopefully identify which of your relatives has that same genetic predisposition, and then potentially treat or prevent cancer in that next generation altogether. Even though in our study we offered this cascade or family testing for no cost for up to 90 days, only 20% of relatives took us up on this. So this really showed us that financial barriers are not the only barrier to families understanding, communicating this risk, and undergoing that preventative testing. There are probably a number of other socioeconomic and emotional barriers that we have to now deal with. Now that we've seen the results of this study, it will be really transformative for Mayo Clinic's Cancer Center, and we're putting together a task force now called Project Target, which will take the findings of this study and begin to translate it into the day-to-day practice in all of our cancer centers, so that every cancer patient that eventually comes to Mayo Clinic will be offered genomic evaluation that includes genetic testing to identify did they have an underlying genetic mutation that predisposed to their cancer, and how do we incorporate that knowledge into designing the best surgical and treatment options for this patient and prevention for their family. We're going to be rolling that program out in the first quarter of 2021 at our Mayo Clinic Arizona campus, and then soon to follow in all 3 of our campuses.